Hey everybody, something we're going to talk about and really important, affects a lot of people, and that's herniated disc. What does a herniated disc look like? This is a normal disc. On the inside you have soft material, outside you have pretty hard material. But when you have a tear in the outside material, the inside comes pushing out. It can cause pain by causing pressure on the nerve. Herniated disc can make it difficult to walk, sit up, to do anything, as a matter of fact. So today what we're going to go over is good exercises to do for herniated disc. I have April here, she's going to help me. So the first thing that we're going to show you is, because when you have a herniated disc, it's even hard to sit down and straighten your leg out. Because when you straighten your leg out, it causes more pressure where that disc touches the nerve. So one of the first exercises we're going to go over is just working on abs. You can sit right there, working on abs and working on getting motion in your spine. Like I said, if you've had a herniated disc before, you know what it is. You know that you can barely move. So small motions that can actually activate muscles and get range of motion is the direction that we're going to go towards. So what I want you to do is, we're going to first just go straight up, pulling your body straight up, almost like there's a string at the top of your head, pulling straight up. And then we're going to slouch down forward, keeping your shoulders there, but contracting the abs as you go forward. You can keep your head looking straight ahead. There you go. Go back up all the way. It's almost like you're treating your spine like it's an accordion. You're going up, just getting range of motion like this, and then when you come down, activate the core, activate the abs. Good. And what's that doing is allowing us to get some rocket at the pelvis, as well as range of motion at the low back, without aggravating the spine. And back down. So my suggestion is, this is usually the best way to start. You're sitting down, which is somewhat tolerable, back up, and then squeeze and tighten down the muscles. Yes. Start doing this at home 10 times, 3 times a day. All right, so the next one we're gonna do, I'm gonna have you lie on your back for me, please. All right, so this is what we call a pelvic tilt. It's still targeting the muscles of the stomach, but also it's gonna be affecting the glutes as well. What we're gonna do is bend both knees. You feel my hand behind your low back? I want you to flatten out my hand with your low back. That's the best way to give instructions, because what you're really trying to do is engage the core muscles and rotate your pelvis back. But it's hard to tell someone to do that. So if you're at home, you can start off by putting your hand behind your low back and just trying to flatten out your hand with your low back. Push down. Good. Which engages the core. Hold it for about 10 seconds. Good. And get some range of motion in the pelvis. Great exercise to start if you have herniated disc, because if you have a herniated disc, you can't just fix the herniated disc just like that. But what you can do is strengthen the muscles that help stabilize the pelvis, helps stabilize the area of your low back, and helps push information through that nerve that's been affected by the herniated disc. All right, so the next exercise we're going to do, we're going to do a bridge. This is usually the second level of exercise that you can do. You're going to keep your knees bent just like that. What I want you to do is lift your hips up in the air, squeezing your glutes together, and back down. This is called a bridge exercise, which activates the glute muscles. The glute muscles are a high stabilizer for our pelvis. Back up again. It's a stabilizer for our pelvis, so as our glutes start to get weaker, we're more vulnerable. Back down. One more time. And as you progress, these exercises should become easier for you. Your pain should start to decrease, and these exercises should become easier. If it becomes too easy, what you can do is modify it. Have one leg straight ahead and back up. Right. So that's a modified bridge where you just targeted one side. And with herniated disc, depending on which side you have the disc herniation, you may notice weakness on one of those sides. So this may be harder, but it's good just to be able to target those muscles. So the 3 exercises, the accordion for your spine. Obviously we went over the bridges, and also we went over the one-legged bridge. Very good. All right, so if you have any questions, obviously give us comments, obviously like the page, and we'll love to give you back some feedback. Thanks a lot.